Has clinic. I'm going to tell you about the clinic case now. Patient identification: name Mr. Juan Perez, age 56 years, sex male, marital status married, occupation dentist, and address Santa Cruz. Mr. Perez has been feeling very tired and fears late history of present illness. Mr. Perez has reported increased fatigue, excessive tears, and frequent urination over the past 3 months. He has noticed a recent unexplained weight loss of approximately 5 kilos. These symptoms have progressively worsened, especially during the last month. Several clinical things have been observed during the patient's recent visits. Blurred vision has been experienced, and occasional numbness in the feet has been reported. No episodes of fever or vomiting have been documented. Medication for these symptoms had not been initiated prior the consultation. Dryness in the oral mucus was not, and mild fundus blood was detected during the ophthalmology examination. Abdominal tenderness and organ enlargement were not found. Lifestyle factors contribution to the condition have been identified, including a high carbohydrate diet and lack of physical activity. Pathology history: hypertension has been diagnosed 6 years ago, and it has been controlled with amapolate. Family history of type 2 diabetes been identified as his father had been diagnosed with the condition. No allergies have been reported. An appendectomy was performed when the patient was 25 years old. No pathologies history. Smoking had been practiced in the past, but was stopped 10 years ago. Alcohol is occasionally consumed on weekends, especially when a diet high in carbohydrates and processed food has been followed. Physical activity has been neglected, leading to the sedentary lifestyle. In general appearance and vital signs: BP 142 90 millimeters for mercury, and HR 98 BPM, and RR 80 18 4 minutes. Temp 98 and 6 Fahrenheit. BMI 29.4 kilograms, points burns per meter.
Hi, my name is Leida Yvette, and I will tell you about the patient's physical examination. Okay, chest and thorax, long, clear to auscultative bilaterally. Head and neck, head atraumatic and normophysiologic. No lymphadenopathy. Oral mucus has been dry. Eyes, middle, blurred fundus. No nephropathy yet. Thyroid, non-palpable, no nodules detected. Abdomen, soft, non-tender, non-distended, no hepatosplenomegaly. And laboratory tests, the patients, in the patient, fasting blood glucose 158 milligrams per deciliter, creatinine 1.1 milligrams per deciliter, and lipids profile LDL 145 milligrams per deciliter, triglycerides 210 milligrams per deciliter. The patient is diagnosed type 2 diabetes mellitus, hypertension controlled, obesity class 1. In conclusion, for your treatment, I will the patient you must eat healthy at your life. You should exercise 3 times a week for at least 30 minutes. You should drink 2 liters of water a day. You should eat at least 2 fruits a day. Recommend fruits should be acidic. You should get your proper 8 hours of sleep. You should avoid being angry or stressed. You should visit the endocrinologist for checkup. You should visit the cardiologist for a checkup. You should visit the nephrologist for a checkup. Uh, I lifestyle change. Mr. Perez must adopt a healthy diet throughout his life. He should for at least 30 minutes of physical activity 3 times a week. He should drink at least 2 liters of water daily and consume 2 fruits per day, with emphasis on acidic fruits. Additionally, he is encouraged to get proper sleep 8 hours per night and should avoid stress and anger. 2. Follow-ups. Mr. Perez will be referred to the endocrinologist for a check-up to manage his diabetes. He will also be scheduled for a cardiology consultations for a cardiovascularity check-up and nephrology consultation for kinder functions. In the medications, I have recommended that Mr. Perez maintain his current antihypertensive treatment with amlodipine for managed diabetes. We will discuss potent medication at his follow-up appointment with the endocrinologist.